Hello, so it's been 3 years since my TIF surgery, and I wanted to give an update as to how I'm feeling after the surgery and just give an overall review of the surgery in general. So, June 20th, 2003, I had the surgery, the TIF surgery, and the surgeon wrapped around my fundus of my stomach around the front of my esophagus and wrapped it around 300 degrees. I just had an endoscopy recently, 2 months ago, and I wanted to give some info about the endoscopy findings and how I'm feeling today. So before I had the surgery, my quality of life was very low. I was basically miserable, and now I'm doing much better. With that said, I'm still taking one Nexium pill a day, 20 milligrams, which is, I used to take 4 a day. So now I'm only taking 1. So I'm doing much better on the medication front, and I'm feeling much better in general just taking the small amount of Nexium. If I don't take the Nexium, I do get some acid reflux. I think that my esophagus is hypersensitive in some ways. So maybe somebody else who didn't have the hypersensitivity, maybe they'd be able to get away with the surgery not having any Nexium at all. But I feel a little bit of acid reflux when I don't take the Nexium, so I take it every day. Also, when I don't take the Nexium, I feel like I get stomach pain. I feel like I get gastritis or inflammation of the duodenum, which is past the stomach. And on my recent endoscopy, they found that I had some inflammation in the duodenum. So before I had the endoscopy, a couple days before I had the endoscopy, I ate some kiwis that were acidic, and I had a lot of stomach pain after eating those kiwis, and I think that may have caused some of the findings of my endoscopy. So further on from the endoscopy, I had a diverticulum in the esophagus, which is basically a bulging in the wall of the esophagus. And I'm pretty sure I know when this happened. I ate some cookies that were dry and that was stuck, and I tried to chug water, and I felt this massive sharp pain in my esophagus when I did that. And I think that's when I kind of bulged my esophagus out, when I was trying to force down the dry cookies with water. So now I have a bulge on the side of the esophagus, which it can be benign long-term, or it can worsen over time and require an additional surgery at some point. Probably not, but they did find that bulging on the side of the esophagus. Another thing on my endoscopy is that they found that all of the fasteners, I had 18 fasteners in the esophagus at the time of the surgery. All of them are pulled through. So none of them are visible inside of the esophagus anymore. And a lot of them are dangling loose inside of my stomach. So my wrap is still intact, but the issue is that they're not attached to the esophagus anymore. So what I think is holding the wrap together is scar tissue. The wrap is in good shape. The valve looks good. I may include some pictures in this video so you could see what it looks like. But the valve looks much better than it did before the surgery. It's just that all the fasteners have pulled through the esophagus, and now what's holding everything together is scar tissue. I try not to overeat because I don't want to cause any degradation in the wrap, because I feel like that might kind of pull it apart. So I don't get too full when I eat. I just feel a little bit full and then I stop eating. So with that said, I have lost weight since the surgery. I used to weigh a lot more than I do now. My hunger has decreased, but overall I'm feeling okay. Sometimes I do have some pain. I can't eat really fatty food anymore. Really fatty food just causes stomach pain, I think, because I have the inflammation in the duodenum. That's where the bile empties out. I also think I get bile reflux into the stomach. So whenever I eat fatty foods like ribs, especially ribs, I get stomach pain. So if I do eat ribs, I limit myself to 2 ribs at a time. And if I have any more than 2, I end up feeling pain. So overall, am I happy with the surgery? Yes, I feel like the surgery was a success. If I had to have the surgery again, would I choose this surgery? I would choose an anterior 180 wrap over the TIF surgery, for the reason of esophageal spasms after the surgery, because the wrap it felt like it was tight and maybe my esophagus didn't like all the fasteners in it. I had constant esophageal spasms, and now I feel like my esophageal spasms have really quieted down now that all the fasteners have pulled through. But for a period of several years, I would say I had just constant esophageal spasms. It would interrupt me when I would talk. Like if I would talk 5 sentences, I would have to pause midway through the 3rd sentence because I would have a spasm in my esophagus that would just stop me in my tracks. So the GI doctor even prescribed me baclofen to stop the esophageal spasms. So in other words, what I'm saying is I think my esophagus knew that the fasteners were in there and didn't like it, and it was just constantly wiggling and moving and trying to get the fasteners out, and eventually the esophagus worked those fasteners out, so they're not in there anymore. So if I had to do the surgery again, I would get the 180-degree anterior wrap. It's called a Door or a Watson. It was offered to me by a surgeon, Dr. Lipham in Southern California. He's one of the best GI surgeons, foregut surgeons in the world. And he offered me the choice of the TIF surgery or the anterior 180-degree wrap. He seemed like he wanted to do the 180-degree wrap more than the TIF surgery, but he didn't explicitly say that. So I don't want to put he left it up to me. And I didn't have the surgery with him. I saw another surgeon who was very good. I flew to Texas for the surgery. And he was experienced. He's done a ton of these TIF surgeries. I went to the Texas surgeon because I didn't want to have a resident doing any surgery on me. I wanted an experienced surgeon to do the surgery on me. And Dr. Lipham let me know that a resident may be working on me, and I didn't feel comfortable with that at all. There's a lot of sensitive things in the area. If you nick an artery in the area or something like that, one simple mistake and it could have catastrophic consequences. So I didn't want to risk that. So I had another surgeon in Texas do the job. I feel like he did a great job. It's just my personal sensitivities, my hypersensitivity in the esophagus, I feel made the TIF not as good as it could have been. And now I think my wrap, based on the pictures of the way the wrap looks now, I think it's closer to a 180-degree wrap anyways. So if I would have got the 180 initially, I probably would have had an easier recovery, and I would have probably never had the diverticulum, the bulging in the side of the esophagus, and I probably would have had fewer side effects. And I'm guessing that I would have had similar symptom resolution. So the 180 is what I would do today if I had to redo the surgery. And so, yeah, I just wanted to make this video and help anybody else who's considering anti-reflux surgery. If you're dealing with heartburn, I'm really sorry. It's a miserable disease. Acid reflux is a miserable thing to be dealing with. Oh, another thing I wanted to mention, I cannot have any trigger foods. I cannot have tea. I can't have coffee. I can't have anything like that. Onions, chocolate. Unfortunately, I can't have any of these foods. They do relax the esophagus, and I start getting symptoms in my throat. I could feel just the acid getting in my throat. Not acid because I take a little bit of Nexium, but I feel irritation in my throat, all up my esophagus. So I cannot have any trigger foods. And so it is kind of a bummer that I can't have tea or coffee. I mean, I really enjoy caffeine, but I just can't have it. So I'm 40 years old now and I can't have any coffee. So I deal with some fatigue sometimes, especially, I'm not eating as many calories as I used to and not having coffee as a stimulant. So yeah, I'm dealing with some fatigue as well, and it might have something to do with my inflammation in my stomach and my duodenum as well. So yeah, I can't have any trigger foods. And when I initially had the surgery, because the wrap it felt like it was tight, I was able to have coffee all I wanted. I was able to have tea all I wanted. But I still could not have hot brewed tea because my stomach was too sensitive to the hot pour over. I had to have cold brew. So the hot pour over coffee it did cause me a lot of stomach pain. So overall, I have a sensitive stomach, and I think that has a lot to do with my acid reflux. Whenever I eat, sometimes if I eat, there's certain vegetables that will cause irritation in my stomach, and it will cause a little bit of reflux. So I think my lower esophageal sphincter kind of relaxes when I have some food that irritates my stomach. So it's all interconnected. And a lot of times also I get heart palpitations when I eat foods that irritate my stomach as well. So I have to be careful with what I eat. So it's all interconnected. I feel like a lot of my heartburn issues are caused by IBS or other issues like that. I've had breath tests. I've had all the blood work and everything like that. The doctors haven't really been able to find anything else wrong with me, but I am having a lot of GI issues that are not acid reflux related as well. So anyways, that's all I could really think of right now. Feel free to ask any questions. I'm happy to help. If you have any questions about the TIF surgery or acid reflux or anything like that, I hope you found this video helpful, and I'll check in again maybe in a year or two later to let you know how I'm doing. Thanks for watching.